My name is Frentoria Welch, and I'm here today presenting my capstone project on decreasing catheter urinary tract infection in hospital settings. Um, CAUTI comes from bacteria that affects the urinary tract system from prolonged use of the catheter bag not being hung below the patient bladder, improper technique, non-sterilization when the initial insertion of the catheter, um, also not emptying the bag out in a proper amount of time causes the patient to have an increased risk for getting catheter associated urinary tract infection. Basically, the bacteria goes into the urinary tract system and it affects the bladder, the kidneys, and the urethras. People get polynephritis, which is a kidney infection from UTIs. They get bladder cystitis, which is an infection of the bladder from urinary tract infections. And a lot of this can be avoided with proper technique, management, and following the criteria for patients getting the Foley catheters. The rationale for this is following the hospital policies and using proper technique will reduce the admissions stay for patient. It will reduce costs for the hospital because most insurance don't pay, like Medicare and Medicaid would not pay for that because it's the most common type of bacteria that can be prevented. So most of the time they're not going to pay, so the hospital cough up money for treatments when patients have catheter associated urinary tract infections. My expectation for this project is to educate nurses and techs on how to manage Foley catheters, nurses on how to properly insert Foley catheters, and also to see a decrease in the percentage rate each month in regards to CAUTI. So the pickle question is, how can the nursing staff reduce catheter-associated urinary tract infections in hospitals in the next 30 days compared to nursing homes? Research. According to the Virginia Health Department, nearly 1,000 people are affected yearly. Two-thirds of those patients are affected because of catheter association urinary tract infections. And it is estimated 2.3 deaths are related to UTIs. The treatment cost for each ranges between $750 to $1,000 each treatment, which annually is millions of dollars that the hospitals are coughing out each year for something that can be prevented. Okay, in regards to the procedure, before you initiate the urinary, the Foley catheter, you want to check the order. You want to make sure the patient meets the criteria. Some criteria follows like surgeries, long, heavy amounts of diuretic like Lasix, the mobility if the patient is immobile because of knee surgery, critical patients like ICU patients that's on ventilators, they would need it. And some people that's on hospice use it as well as for like comfort for their family. And it also helps reduce pressure ulcers because some people that are critically ill do soil with stool or urine, and keeping that patient clean can prevent them from getting a urinary tract infection because sometimes the urine back up into the catheter, and sometimes stool can get into the catheter, which put the patient at risk. So it's very important to make sure you check to see if the patient is incontinent. See when the last time the patient had to urinated. You also want to check the history. You want to see if the patient is allergic to latex gloves. Once you go assess your patient, you want to go ahead and start washing your hands and put on clean gloves. You want to adjust the patient Females, they like them laying on their back supine position with their legs flexed and relaxed. Males, they can just lay on their back. You want to clean the area with soap and water, because sometimes if you get a patient from a nursing home, they might have feces because it's a sterile technique. So you want to make sure that the patient is clean and the patient understands what's going on. And you also want to make sure that you get the correct size. A lot of catheters have different size. They got 14, 12, 16. 16s are for normal size patients. So make sure you have the right size catheter, because you can't damage the patient. Once you assess the patient, prep the patient, you want to make sure if you need a tech or whomever to assist you, because sometimes obese patients or elderly patients, they won't hold their legs wide enough. So you might need assistance. You want to get everything you need to the bedside before starting the procedure. Okay, once you have everything at the bedside, you still have on clean gloves. You go ahead and you take clean gloves off and you wash them. And then you open your Foley kit. In your Foley kit, it'll have a hand sanitizer where you will wash your hands before starting. It will also have the directions, and it will have the label. The label, you will put the date and time, the department, and your initials on when you insert the catheter. You will put this on last. So you will open the Foley package from the outside, because remember, everything is a sterile technique. So I have on clean gloves, and I'm opening it from the outward. Okay, so once I open it, on top is the sterile gloves. So I'm going to take the gloves out. I'm going to open it. You want to make sure when you're putting on the sterile gloves that you don't touch the outside. So what I'm going to do is I'm going to scoop my hand inside of the glove. You see, I'm not touching the outside, because you touch the outside, you already contaminated the glove. Then I'm going to put the other glove on. Now I can touch, because I'm touching on the inside, sterile. So with the drape, you want to cover the patient's private area. So you will drape this over the patient to give them privacy. You'll drape this over the patient, like their lower abdomen, and then you will take this drape and place it over the vagina or penis. So once you drape the patient, again, this is sterile technique. You have the betadine. You open the betadine and you pour the betadine into the container. And this container, it has the betadine, the syringe, the cup that you're going to catch your fluids in. So you pull. Out. See, the catheter is still sterile. So what you want to do is put it inside the container. The normal saline, you want to check to make sure that the catheter still works. So what you do is you connect it. So you connect it to the hub. You're going to take this off and zoom in. What you're looking for is this to bubble up. That means that the Foley works. So you just drain it back out. With your non-dominant hand, which will be my right hand, I will let the patient know that I'm about to clean him or her. With the women, you want to open their labia up, and then you go from one side, discard, one side, discard, and then in the middle, discard. For the men, you do you hold it in a circular motion. Okay? This is the petroleum jelly. Again, I have my labia open, and we're still using the sterile technique. So what you want to do is take the Foley catheter and you want to insert it in the ureter. You want to keep inserting until you see urine enter the tube. Once you see urine enter the tube, that's when you insert the normal saline. The normal saline helps keep the Foley in place. If you feel resistant or you missed while you was trying to get into it, you would have to start all over. So you would have to throw all of it away and start all over, because you have already contaminated the patient if you insert it. So once you already insert the saline, you want to make sure you hang the bag on the bed frame and not the rails. Then to secure it, you want to place the Foley tube, the catheter tube, inside of here. Initially, what you're going to do is you're going to wipe the inner thigh down, and then you're going to peel these back, and it'll let me close it. You close it, peel it back, and it'll stick on the patient inner thigh. And then once you do that, you want to go ahead and hang the bag, because the urine will be starting to flow. You want to hang it again. You want to hang it not on the bed rails, but on the bed frame, something that does not move, and it has to be below the bladder. And then once you finish that, you label it on the back of the bag. Most facilities like you to collect a urine culture and a urine analysis, just to make sure that it wasn't hospital-acquired an infection. Once you already get your patient set up for the Foley, you want to make sure you do your rounds on the Foley, meaning you want to make sure that you empty the bag out in a timely manner. If the patient has stool or soil, you want to make sure that you clean the patient up again, because you're putting the patient at a risk for pressure ulcers, and you put the patient at a risk for bacteria infection. You also want to educate your staff, your techs, on the proper technique of every time you go in with the patient, you want to wash your hands. So after you finish doing the technique, you wash your hands before you leave the room. You wash your hands when you enter the room. Proper hygiene is very important, especially with dealing with patients with Foleys. Okay, so the recommendations is educating nurses and tech on how to maintain dwelling catheters, educating nursing and techs on the importance of proper hand hygiene. The unit should have the criteria posted where they keep their catheter supplies, their urinals, where the nurse can be reminded, does this patient meet criteria? If the patient do meet criteria, that's when you implement the indwelling catheter. Also, make sure that there's no kinks. There's no kinks in the tubing, because all it does is backflow back into the patient's bladder, which you're just bringing bacteria back into the patient body, which is not a good thing. So you want to make sure there's no kinks in the Foley. Again, the Foley needs to be below the bladder, and please don't hang it on any bed rails. And most importantly, discontinue the catheter when warranted. If you assess a patient that had knee surgery and needed it for temporarily, but now the patient can use a bedpan, discontinue the catheter. Never put a catheter in because you don't want to get constantly go to the patient room to take him to the bathroom or put him on a bedpan, because that's not what the catheters are for. In conclusion, catheter-associated urinary tract infections are one of the most common hospital-acquired infections. They come from improper technique from inserting the catheter, non-proper hygiene, hand hygiene, not emptying the Foley bag in a timely manner. It can be avoided because it causes prolonged admission stays, and the hospital pays a lot of money for these treatments when it can be avoided. Again, proper management. Proper technique and education will decrease catheter-associated infections in hospital settings. Thank you.